Well, we want to welcome everybody to the inaugural episode of a podcast that Alex McDonald and I have been talking about for a while. We're calling it, for the time being, Healthcare Uncut, Unfiltered. I'm here with Alex, like I said, Alex McDonald and Brandon Lovelace. And oftentimes whenever you are flipping through the catalog of podcasts out there, you dive into the why of each podcast that you pick out. So for a couple minutes, I want to start out and tell everybody kind of why we're talking about healthcare in an uncut, unfiltered way. And at the moment, being with these two guys in the business we've worked in for quite some time, we've all been able to experience the difficulties that come, the brokenness of healthcare. And it's been on our hearts, I believe, for a considerable amount of time to just sit down and discuss, to rap about what is going on in this healthcare space and what we've found as solutions that can help navigate around a lot of the issues that you run into as an employer, as an employee, or as a provider in the healthcare space. And so this podcast, Healthcare Uncut Unfiltered, is going to be designed to share things that we know in this space that work really, really well to help employers bring a employee benefit plan to their employees that allow them to be a healthier, more productive employee without all of the red tape and trappings that come with traditional and conventional healthcare. As we get down this road, where our hope is to provoke some thought, to offer some ideas, offer some solutions, and if needed, be a resource for anybody out there that sponsors a healthcare plan and contributes and deals with the issues that lie out there in the broken landscape of healthcare. I'm here again, like I said, Alex McDonald and Brandon Lovelace. I'm going to flip it to Alex and let him talk about why he's here, what he thinks about episode 1 of Healthcare Uncut Unfiltered.
Well, I'm just excited to be here. We have been talking about it a long time, and it's going to be fun to discuss a wide range of topics. But yeah, the reason why we're here is basically to let everyone know, whether that's an employer, an employee, a physician, a broker. There's a wide range of people that could benefit from this information, and that information is, there is another way to build a health plan that is easier than you think, and it's a movement that's already started. And Mark and I have been involved in it for a few years now. Brandon's been involved in it, whether he knew it or not, by being someone who's on one of the health plans that takes advantage of these things. But the idea is, the buzzwords are free market medicine, direct healthcare. We'll probably think of some other buzzwords that are floating around the industry. But at the end of the day, all it means is that the simplest way to deliver healthcare is to connect the provider, whether that's the physician or a facility that provides healthcare service, and the buyer of the healthcare, or the consumer, which is either the patient themselves or an employer that's paying for that service. And the reason healthcare is so complicated in this country is because there's 1 million people in between that transaction right now. And this movement is eliminating the majority of that. And it's amazing. I don't know any other way to put it. It saves money, it saves time, it improves outcomes. And physicians love it, patients love it, there's everybody that is involved in it, absolutely is happy with this product.
It's a win.
And when you hear about it, as we talk more about it, if you don't know about it, it's kind of just a simple aha, like, well, why didn't somebody else think of this a long time ago? And there's a million answers to that question. But the good news for everyone out there is that it does exist. It's being done. It's growing. And we want you to be a part of it. We want everyone, the entire, like, our goal would be that the entire country utilizes this type of system. and we're this podcast is here to just talk about it and help people understand it from many different perspectives. And that's kind of a good transition to Brandon or B-Love. He's here to help us technically. He's also here to give us the voice of reason sometimes if we get too deep in the weeds.
Yeah, I think I know everyone has a healthcare story, and they have had challenges that they've had to face along the way. And I am certainly no exception. I had 2 years of turmoil trying to figure out how to pay for the birth of my son. I had no idea how to do it. They were double charging me on things that I didn't understand. And I'm sitting right now with the two people who helped me learn the most about healthcare and how to, navigate the system and how to make sure that you're paying what actually happened rather than being double paid or being told you owe something that is just ridiculous because, once again, the terms don't make sense to me as I'm reading them on a paper anyway. I don't know what CPT codes are, which we've talked about before, and I don't know what a CFO is or a CHRO, but I promise you everybody has medical issues and they have to deal with the system that we've created. So I'm excited to be here and to just ask questions and to pick your brains as you guys help me learn more and help our listeners learn more. So thank you so much for letting me be here.
Well, we're excited to have you, Brandon. You had a great calming influence to Alex and I, because I think he and I can get riled up and go off on a tangent where this stuff's concerned. But at the end of the day, whenever you flip through your library of podcasts and you want to pick a podcast out, you want to talk to somebody knows what they're talking about. And so I just want to share a little bit about who I am. I'm an employee healthcare consultant, and my job in the world every day is I get up and I do my best to talk to employers about how their employee healthcare is running. And so I try to bring solutions that overcome issues that they might be experiencing. And that number one issue is a very expensive renewal every year. Our healthcare renews at a calendar process, and every year, if you're in a standard traditional healthcare plan, you're fighting a 10, 12, 17. I saw 21 to 24% increases this year. And so in the marketplace that I live in, my desire is to talk to an employee healthcare administrator and say, hey, look, there are strategies. I don't care what your broker or consultant's telling you. There are strategies that you can employ that add money to your bottom line, that make healthcare more readily accessible to your employees, and it's not confusing. The vast majority of people that are on an employee-sponsored health plan go to the emergency room for the very reason that they don't know how to navigate their employee benefit plan. And so my desire is to share with them what we can do to help mitigate some of that issue and to drive their costs down, because it doesn't have to be as expensive as it is. And I said something earlier, Alex, I want you to expound on this as we get on the road. But I said the broken nature of healthcare. Well, there's something that just kind of crossed my mind after I said that, is healthcare is really, there are three big players. Healthcare is not broken for three entities. It's not broken for the broker. It's not broken for the hospital, and it's not broken for the providers. And that's who it's not broken for. It works perfectly for them if you are in the traditional, the carriers, not the providers, the carriers.
Right.
Hospital, carriers, and providers. It works perfectly for them. And so we'll get into a little bit more of that, but give us a little history of kind of who you are and why everybody should listen to what we're telling them about the employee healthcare space and how we can help them solve problems.
Sure. So I stumbled into healthcare several years ago. Well, I shouldn't say a decade or more ago. And I worked in the traditional healthcare space. Worked for a large orthopedic group. Knew nothing about healthcare, honestly, when I started, but when I left, I knew a lot. But I knew a lot about the traditional system, and and that seemed fine to me, honestly. Like that, it's complicated, but it's what every physician has to do. It's what hospital. It's how everybody works within the system. And there was, complaints about certain carriers, this paying that, and there was little battles in between in the trenches, in the billing departments and things. But for the most part, you do the work, you bill it, you get paid. I learned a lot about that. Fast forward a few years, and I stumbled again into what I now know is free market medicine. I didn't really know it at the time, but just had an idea and went to go implement it, and then realized this whole world existed. And then that's where I've been ever since. And I think, met a lot of people that are doing it. Oklahoma, for whatever reason, has been the birthplace of it. I think there was several key players in that, and hopefully we'll have some of them on in the future as guests. But it was kind of easy here because there was already some people doing it, and the expansion of it organically happened very easily. Now, when you move into other states, it gets a little more difficult, but it's all over the country. I think I'm pretty sure it's some form of it is in all 50 states at this point. And so at the end of the day, as Mark mentioned, this current system works really well for a few players, and there's a lot of money in it. And our goal is, imagine, healthcare, and I don't know the full history of all the healthcare system in America, but just imagine going back to 1950, let's say, and you were sick and there was a doctor in town and you went to that doctor and you'd pay that doctor for that service. That's what we're talking about here, guys. Now, it's not quite that simple, and it never will be, although in some instances it is in this market. There is very much a direct doctor-to-patient relationship that exists. That's called direct primary care. Lots of docs across the country are jumping on board as fast as they can. It's basically that 1950s model. Now, when you get into other things where you are on your employer's health insurance, the only layer we're adding is that the employer is now going to pay that doctor instead of the patient. That's really it, and kind of, simplifying it to that level is really the ultimate goal. We're not going to pretend that there aren't other layers in between on certain services. There's pharmacy. There's a lot of complicated things out in healthcare that have to be regulated, that have to kind of have some red tape involved. But if we can boil this down to the most simplistic form of delivering healthcare the way it needs to be, we've seen that it improves everyone's life except for the big systems. And even in that sense, there's a few hospitals jumping on board and they're improving. There's not a lot of downside here except for the layer after layer after layer of middlemen. And honestly, guys, like, there is no other system, no other industry in, I don't want to say the world, but certainly the United States that functions the way healthcare does. There are some regulated industries that aren't pure free market, but for the most part, there is a lot of transparency and kind of everybody knows what's going on. Healthcare is the one place nobody knows how it works, really. Even the people that say they do, there are layers they don't know how it works. And that's strange comparatively to every other industry in this country. We wouldn't allow it if it was, a restaurant or an office supply company or a hardware store. Imagine walking into a hardware store and there's no prices on anything. And they say, well, that depends on who you work for and what their hardware plan is. Well, no, I just want this hammer. How much is that? No, I can't tell you. It's a strange way that we've built this in this country. And I'm sure there's probably some guests out there that we could target in the future to maybe bring in to kind of give us the history of that, because I'd love to know. It'd be fascinating. How did we get where we are? I'm sure there was some legislation passed at some time in the 60s and 70s that sort of started this ball rolling. But man, we're here now, and our job is to claw ourselves back out of it.
You're dead on, and it's very well said. I do like the idea of just doing healthcare uncut, unfiltered, and just doing it the way. And our goal in this podcast is to show people that you don't have to do it the way you're being told. And it all lies around plan design. How do you design your plan? And at the end of the day, if you don't have a consultant or broker or insurance salesperson that is willing to put your bottom line ahead of his bottom line, you're going to be stuck on the hamster wheel of 12, 15, 17, 20% renewals, like what we're talking about. And so it starts at plan design. It starts with dealing with someone that knows the space. It's as simple as a diagnostic image. If you've got an employee that works for you and you're an employer and you've got an employee that works for you and he needs to go get a diagnostic image, the end of the day, the way that works is the doctor says, you need an MRI. I want you to go here. And they send you off and you go to their MRI, and that doctor typically will own a portion of that MRI, and he's keeping you inside of a profit corridor so that he can make profit off of you, not only in the office visit, but on the MRI. Our idea and thought and why we're on this podcast is to say, hey, look, let's interrupt some of these processes. Let's get people outside of that profit corridor and show them that they can consume healthcare. They can become a legitimate consumer of healthcare, meaning instead of buying that hammer and not knowing the price, you can go get this MRI and call health check screening and say, how much for an MRI? And they'll tell you before you go how much your MRI costs. That's unheard of in this healthcare space. People don't realize that they can actually be a legitimate consumer of healthcare. They feel like they are in a system of healthcare, not in a marketplace of healthcare. And so we want, with this podcast, to show people or to help people stop thinking systemically and think as consumers, and how much do you want to pay for that healthcare? How much do you want to pay for that surgery?
Well, under this, little analogy we're giving, imagine that you work for a company and your employer said, go to this hardware store and get this hammer, and they won't tell you the price, right? You might have to pay for part of it yourself, and then maybe your company will pay for part of it. You don't know how much, you don't know what you need to cover. The hardware store might say, hey, give me $50 right now, and then we'll sort out how much you owe later and how much your employer owes later, right? Under this system, here's what would happen. You'd go down to that hardware store and you'd say, I need that hammer. How much it's going to be? And the hardware store owner would say, hey, don't worry about it. Your employer called ahead and they've already paid for it. Just take it. Really? I can just take it? I don't owe any part of it? No. They're covered in 100%. Just go use your hammer. You're done. That is literally how this works under this system. And it's that's why it's so incredibly exciting, because that MRI, that employee goes to the MRI facility and says, what do I owe? And they say nothing. Your employer's covering 100%.
Brandon, hammer is code for MRI.
Yeah, I guess so. It is now.
I know personally, before I had a plan like this, I went to the ER with my wife and we had to pay like a $600 copay. I remember they sent us home with some meds, and later on the day she was like, I'm getting worse. I'm worried. I need to do something. I was like, well, I'm taking you back. I mean, you're worth more than $600 to me. Let's make this, let's take you back. So I took her back. Same thing. We'll write you something else, and then another $600 copay. And I'm like, well, I'm paying $1,200 just to come in here. And honestly, the next time she was hurting, we had this thought in the back of our head, which is insane, which is, hey, you think you might actually be okay? Maybe I could just find some of the meds they prescribed last time and we can try those first. We can't even go to the hospital without thinking about how much it's going to cost. And then fast forward, I remember when I'm on this new plan now with you. It's not new, but it's, it
was new to you,
new to me. And I remember when we got told, like, these are the facilities you can go to and they're covered. And I thought, well, that's crazy, because most often when I have to make a decision, it's in the middle of a crisis. It's always a crisis. So when you make crisis decisions, you don't care where, you just go. So if I've already been educated before the crisis to know where to go, which is what happened, we went to this new ER for something for my son that we knew was part of the plan that we were educated on. We walked in there. I got out my card. I was like, hey, I'll pay the copay. I know. And they're like, well, there's no copay. It's like, what do you mean?
They roll out the red carpet, didn't they?
Yeah, it was amazing. I'm telling you, it was absolutely groundbreaking to me. And I want everyone to experience healthcare like that, because it was the first time ever that we thought to ourselves, well, if you're sick, go to the doctor. You can't think like that anymore.
Yeah. That's your why. I got my notes here, intro, why, what, who, and Brandon gave us the story. This is the why of healthcare Uncut Unfiltered. And what we hope to do is to share with an employer how to let their employees do what Brandon just did, to have the paradigm shift that Brandon had about healthcare, because it can be done. We're doing it all the time. We've got proof of concept. We're doing it with 5,000 life groups. We're doing it with 1,200 life groups. We're doing it with 300 life groups, and we're doing it with 50 life groups, and we're doing it with 6 employee groups.
Yeah.
It's working for all groups, all size. The risk is vastly the reason why people say no. We can dispel the risk myth. We can put the risk myth away. Our podcast will come on and we'll talk at some point with someone that does nothing but they underwrite risk. They underwrite the risk of healthcare, because that's why this system is designed. It's designed to finance healthcare. And we got to figure out a different way to finance healthcare. And there is one, and we know it and we can show it. The thing that really comes to my mind is this being an insurance company, the comparison to a hardware store. At the end of the day, we wouldn't ever purchase anything for our homes personally the way we buy something in the healthcare space. And so we want the listener to know you don't have to purchase healthcare the way you've been purchasing healthcare. There's a different way to do it. That the vast majority of the people out there that sell it, that do what I do, they don't want you to know about this because they make less money. It costs you get away from the people that healthcare is winning for, and you get into a situation where you're making your own decisions, and it pays the guy that's helping you do it less money. And so it's really a follow the money Ponzi scheme. It's not a Ponzi scheme. It's a follow money scheme. If you understand who's paying for what, you can navigate those waters. And these providers want to contract with you outside of the carrier, because typically contracted with the carrier, they're going to wait 120 days to get paid, whereas you can make arrangements with them to where you can get paid in 15 to 30 days.
Yeah.
We're living that world too. We're doing that on it. That's
kind
of your job.
That's the crazy part about it, is there's so many efficiencies that, or inefficiencies, I'd say, in the current system, that this system actually cures. Payments speed up, prior authorizations go away. There's red tape that just disappears because it's just not part of the thought process.
Mm-hmm.
It's not to say that there's not safeguards and processes in place again, but if anybody that's ever had their healthcare story, as Brandon said, which everybody does, whether that's a super high bill from a relative that had something bad happen, whether it's a cancer or whether it's a heart problem or an X-ray or an unexpected stuff, like Brandon said, this kind of acute care, panic, what do I do? And then you get a bill 3 months later for $8,000, like that kind of story. This eliminates that with some planning and some education as well. And if you're an employer or a business owner or someone who's in charge of choosing the company's health plan, and you're sitting here thinking, well, that's great, the patient pays nothing, but I'm still paying for it. There's good news for you too. So let's include you, that it's cheaper for you too. So let me give you a scenario. I'm in the diagnostic imaging space now, so we've talked about MRIs, so we'll stay on that. But if you could get your data and you could look at what you're paying for your employees' MRIs right now, it's going to be, from my experience, from the data I've seen with our clients, it's somewhere between, say, $2,000 to $3,000 per MRI. I've seen as high as $25,000 for an MRI paid. I've seen lower, the $600, $700, $800 on occasion on a plan, but the averages across the board are $2,000 to $3,000. So imagine now your employee, as Mark said, needs an MRI. They get sent to a free market facility. They don't pay anything, and you're thinking, I got to pick up the bill now, which normally the patient would have had to pay whatever part of their deductible, so if it was that $3,000 MRI, let's say they had a $1,500 deductible.
Copay. They
pay the $1,500, they get their MRI, then you as the employer get the bill for $1,500 for the balance. In this new system, the employee walks in, the MRI is free for them, and you get a bill for somewhere between $500 to $700. So you've saved $750 to $1,000, and the employees saved $1,500. That's the basic. It's one example, but it happens code after code, claim after claim, service after service, all day long.
Yeah.
And if you do that to your entire health plan, you can start to do the math where instead of a 20% increase in premium, you're now looking at potentially reducing your overall spend. And that has happened. It does happen.
We can show you how.
Yeah. And that's the point. It's I think maybe Mark mentioned it, but we've talked about that this is happening, but guys, this has been happening for a few years now. There's hundreds and hundreds of companies utilizing this system. There's millions and millions of dollars that have been saved, and it is not a proof of concept anymore. This is doable. You could start tomorrow. And we want to show you how.
So buckle your seatbelts, everybody, because we're going to take you on a ride. We're going to take you on a healthcare journey. We're going to dispel some myths. We're going to shine some light in dark spaces. And we're going to talk to some people that are going to be entertaining, and they're going to be helpful, and they're going to show us the pathway to bringing good quality healthcare to a space where all you've ever seen is historically more money and more money and more money out of pocket. I'm excited about taking this journey. I'm excited about going down the road on this podcast with Brandon and Alex. And I just think there's a lot of ground to cover. We talk a lot longer about this in the next episode. We'll have some pretty good nuggets, and we'll dial in and get a lot more specific. But for now, that's a kind of a roundabout way of saying what Healthcare Unfiltered is going to be about. Alex, who are you the most excited, or what are you the most excited to talk to people about as it relates to what this concept really looks like?
Well, I have a lot of guests in mind, but I think I won't name any now just in case I don't want to actually show up. But I want to get providers in here to speak about their experience. I want to get some employers to speak about their experience from shifting from a traditional plan to adding on this type of plan and what that's meant to them. I'd love to hear patient stories, more like Brandon's story of, how it saved them, not just money, but stress and headaches and actually got better outcomes because of it. I am excited to bring people in that can bring this concept to life through true events that happened and let people know that this is this can be navigated. And it's actually pretty easy, and it's kind of fun to do. I
get the meme in my head of how things started, how it's going.
Yeah.
And so I feel like there's some relativity to that. And what I'd like to hear a lot about is, what are the true solutions? Let's distill away all the information and
what you did there.
Get to the solutions of why and how this is working, and let's talk about the seamless nature with which they integrate together, and share with people what they can do, and hopefully become very conversational with listeners. If that's ever on the horizon, we'd love to talk to listeners and share with them, let them share their stories. I'd love to get the stories from people we don't even know, because they're there. And when we go to the FMMA conference and the SCI conference and things like that, we hear them all the time. And so I'm pretty excited about the journey. I want to toast with you guys before we end. And one of the things we'll do as we wrap up our podcast is we're going to toast our podcast. We're going to toast our partners, and we're going to toast each other and talk about a good spirit that we happen to have that week. Alex and I have kind of journeyed off into the hobby of collecting bourbon, and it's not to get drunk and hammered, although that's kind of a fun byproduct sometimes. But we like to sip and taste and smell the notes and understand what bourbon's all about. And today I brought in a tube. I love tube. If you're in the bourbon trade, you know what tube is, but I came across a bottle of E.H. Taylor small batch. And so we're going to pour one up real quick and say a quick toast, and then we'll get out of here. We've got the bottled and bond E.H. Taylor small batch poured up. I want to say a quick thank you to everybody. Cheers to a great journey, a great adventure, and looking forward to the next episode. Cheers, gentlemen.
Cheers.
Cheers.
Tasty.
That is That is a tasty drink.
It's a good pour.
Wow.
It's the second or third time I've done the EHT small batch, and it never has disappointed.
I feel honored to have just sipped on that.
Yep, it's pretty good stuff.
I'm new to it, so I'm appreciative of you sharing.
Absolutely.
And that's kind of part of what we thought we'd tie in the bourbon thing to this podcast, is because this is something most people don't know about. I knew nothing about, the bourbon hunt. I had another friend that has an amazing bourbon collection. I'm like, how in the world did you amass this? And how do you get it? And he started telling me, and it still didn't make sense. And he's using all these acronyms, and it didn't make sense. And it's like, okay, healthcare is kind of like that.
Yep.
And then when you start talking to the people that are doing it and realize, and they start helping you, and you start toasting with them, then things start happening very easily and very organically. And it's almost like I'd always been here. And I kind of know it myself now. So, but it took friends and educated people to get me there. And that's why Uncut and Unfiltered exists.
Well said.
I think it's very well said.
Well said.
I don't know how to capitalize or how to follow that. So at the end of the day, I want to say thank you to everybody that's giving us a shot, taking a listen, and just understand that we'll be back. And we look forward to taking you down the pathway to easier, less expensive, and overall better healthcare. In healthcare, Uncut, Unfiltered.